Afternoon, everyone. Hope you've all enjoyed a active weekend. Exciting news, we have officially sold out for our upcoming running technique workshop in 2 weeks to the date. So very excited to be presenting that. We're going to be covering things like the fundamentals of running technique, and also going to be running through some common drills that can be used. So really excited to have the group that we've got. And for those that missed out, well, we may run another one later on in the year, so keep an eye out. We've previously discussed in a blog asking the question, can you change running technique? Because that's something that people will say, oh, the way you run is the way you run. Can you change it? We answered in that blog, yes, you certainly can. There's been a lot of research to back that up, but it's certainly something that we see anecdotally in clinic as well. But the main question, though, that really needs to be asked is not can running technique be changed, but should it be changed? And in this blog, we covered some of the for and against, and so we're going to run through some of those now. So the first reason for changing running technique is that it can be very useful for modifying symptoms of running injury. So, for instance, and the research has shown this with a lot with patellofemoral pain, so runner's knee, also with anterior compartment syndrome and ITB as well too. So the patellofemoral pain is one that we see, and that's one of the most common running injuries, and that's something that we see, and with that change in pain and influence in symptoms, it's something you can actually see very quickly, and we'll see that in clinic where we'll have someone on the treadmill and we will analyse their running gait, and then we will make a change, and sometimes you see that there's symptoms where they might be running at a 6 out of 10, you're changing a particular part of running technique, and that pain reduces immediately to a 2 or a 3. So it can be very useful to allow the runner to continue training, and whether that change needs to be permanent, well, that's the other question. Whether it just needs to be a temporary change to get them through a particular injury, and then whether they revert back to their previous running technique, well, that's something that is to be considered. I'd argue that if they've got a long history of a recurrent issue that keeps happening again and again, and that particular change was useful in reducing their pain, well, I would argue that it's probably a good change to adopt in future. So that's the first for is influencing pain and running injuries. The second one that we've got for is injury reduction. Now, there's been a few studies that have looked at the changing running technique and different factors of running technique that can contribute to injury. Ludke in their study found that those runners that had a cadence of less than 164 were almost 7 times more likely to get injured. There was also another study by Chan, and they looked at reducing impact shock. So they had a group of runners, I think it was about 200 runners there, and they instructed them on to reduce the impact on a treadmill, and they found in those runners, they found a 60% reduction in injury in those that had the retraining versus those that they just let run. There's also Napier's study as well on his in females, found that those that were overstriding were more likely to sustain an injury. And there's also been a lot of other studies that looked at certain factors and found things like, again, with overstride or changes in knee angle and those sort of things. And you can read more about the specifics in our blog. So that's the potential role there for injury prevention, for working on that. The research is in its early stages, so we look forward to seeing more research in that area. The third for changing running technique would be running economy, and there's been a few research studies that have looked at this and found that those runners that are more economical, as in they consume less fuel per given kilometre, display certain characteristics of running technique, and namely they can be again with the overstride, with increased vertical oscillation, so that's that up and down movement. So that's something we don't want to see, are those really bouncy runners that are going up and down. So Izzy Moore's done a lot of good research in this particular area. Interestingly, whilst we're on that for, that can also be an against with running economy, because when you're getting someone to change their running technique, there can be a temporary drop in running economy. So it can actually be a little bit less efficient, and that's because you're having to think about the movement. It's not particularly natural yet. It's not an ingrained and adopted pattern. So initially, when you change, there can actually be a drop in economy, and there's studies to show that's been the case with those the long-term follow-up. How long that loss of economy lasts for? Well, there's some studies that show that it's as little as a week. Others have done follow-ups at 6 weeks. So we really don't know when that switches. But I usually say to runners, if we are changing their running technique, that they can expect it to feel a little bit harder to begin with, but that by 6 weeks that should be, things should return to the way that they were economy-wise, or potentially even better. And that's another reason why, when changing running technique, you want to try and do the less change as least to have the greatest effect. Because if you're changing a whole lot of things, then it becomes a very unnatural movement, and it can become quite difficult for the runner to adopt. So that's why we got to try and change a little bit there. So that's sort of the first against and for with running economy and running technique. The other one that is an against and something you've got to be careful of is something we call robbing Peter to pay Paul, and that's when we're changing running technique, forces don't just disappear. So a good example for this is if we're instructing someone to increase their cadence. What we know with that is that it does reduce knee load, but it actually does increase load down and through the foot and the ankle and the calf. So what you've got to make sure of is that if you're changing someone's running technique, or you're changing it, you've got to make sure that have you got the capacity to be able to handle that change. So if you've got runner's knee and you say you are increasing cadence, then you want to make sure that you've got the calf and the foot strength to be able to handle that change. So that's the first against. The second one is, if it ain't broke, don't fix it. And this is where, as a clinician, it's really up to us, and also in discussion with the runner, as to do we need to be making changes? What's the injury history like? What's the reason for changing? How much of a change are you going to make? All these things really need to be considered, because I'm not a big fan of changing for the sake of it. There's obviously got to be a purpose and a reason, whether it's a potential injury risk, whether it's to modify symptoms, whether it's to potentially improve running economy. Those sort of things need to be weighed up against the potential downfalls of changing technique. So, and this is where certainly it is, as I said, up to the clinician, and I don't recommend people just go out there and make these changes because there are impacts to doing so. So I'll post the link to the blog on that, so that you can have a further read through that and some of the details and some of the references for those studies. But certainly happy to field any questions on that below, or send us a DM at any time. Enjoy the rest of your weekend, everyone, and we'll catch you all soon. Thank you.